Greetings, Dr. Shiller here. Let's speak about fibromyalgia. I'd like you to get a sense of how you should think about it if you want to heal, and how I think about it, so you can decide whether or not you want to come see me or not. Uh, so I've been working with people with fibro for over 20 years, and as you know, it's an incredibly difficult condition. It's difficult because the various symptoms can be so debilitating, but it's also so difficult because it has historically been that invisible illness that it's hard to put a finger on, and there's so much shame and blame, and conventional medicine doesn't have great answers. Some people are helped by the medications and usual things that doctors do. Some aren't helped. And many of my patients over the years have been harmed profoundly by the approach taken by their healthcare providers, unfortunately. I think those things are starting to change. And we're developing a lot more understanding about what fibromyalgia really is, and understanding the biological underpinnings and influences, which not only helps validate the reality of what it is, but helps us make more therapeutic choices that are helpful for people. So I just want to help you understand a little bit about what's going on in fibro, because that kind of helps understand, well, okay, what to do about it. So I'm going to use some slides just to sort of help clarify. The thing that everyone agrees upon is that fibro, there's a pain processing system that is sensitized. It's not healthy. Its pain is turned up. What is the pain processing system? Well, imagine you got it burning in your hand or a wound or something. That signal goes up the nerves, which are kind of like these electrochemical tubes, and they get to your spinal cord and they talk to other nerves, and then they bring that signal up to the core of your brain and your thalamus and other regions where they talk to other nerves, and from there it goes to the part of your brain that says, ow, my hand feels burning or hot or sharp or whatever it is. And there's another part of your brain that gives you that emotional angst of like, whatever it is, the way you feel it. And the key thing to take away from this slide is that it's a system, and there is processing in that system. It's almost like there's amplifiers in your spinal cord and your brain that can turn the pain up or turn it down. And the greatness of conventional modern medical science is that we've been able to figure out that pain processing is altered in people with fibro. The amplifiers are turned on high, so things that shouldn't normally hurt. We're also starting to see other reasons that could be explanations for why that happens. The conventional view right now is we don't know why that happens, but we do know a lot of different things that are happening in a lot of people with fibro, and there are plausible explanations why this can actually turn up the pain sensitivity and in fact create a more excitable brain in general, and that is overactive and hyperexcitable, and that can lead to a lot of the other problems that happen over the years with people with fibro. So pain sensitization, we already talked about that, but immune changes in the way the cells produce energy, imbalance in the stress relaxation parts of that autonomic or automatic nervous system, which are frequently triggered by trauma or acute illness or any kinds of different other things, changes in the bacteria of the body that we call your biome, infections, viral, bacterial, hormonal changes, neurotransmitter nutrients, deconditioning, because when we are in pain and we're in fear and we don't want to move, the body gets weak, and then when the body gets used, it gets more pain, and it's kind of a vicious cycle. And small fiber neuropathy, which some people say, oh yeah, that's the cause of fibromyalgia, but there's also research that says that the same immune changes that create this hyperactivity of the brain can cause small fiber neuropathy. There's a lot that we don't know, but by understanding a lot of these things, there are common sense therapeutic things that we can do that seem to help lots of people. Let's talk about that. Let's just talk about the disease process in general, because it's important to just get a scope of this over time. This is the arrow of time. What happens that leads to symptoms and disease? Well, antecedents, triggers, and mediators. Antecedents are stuff that happened either genetically early in life, in the womb, or early stuff that kind of sets the stage. It loads the gun, and then there's a trigger, and the trigger starts some kind of process, and then mediators are things that are changes in the biology that perpetuate the process. And so antecedents are genetic stuff, early childhood adverse experiences. Triggers are things like trauma, infections, toxic exposure, gastrointestinal issues, a variety of triggers. And many people with fibro, maybe you, will note, oh yeah, my symptoms started happening and my life started spiraling out of control after that. And that could have been, that trip to India where you got that gastroenteritis, or it could have been that surgical experience, or the car accident, or the horrible loss of the loved one that happened in the context of who knows what. The system gets triggered, and that trigger starts to shift stuff, and then the mediators are what happen. The mediators are all these physiologic changes that we talked about that can perpetuate and feed into the system, and these are like vicious cycles. And those vicious cycles are like a river flowing downstream over time as the process gets worse. And there can be weeks, months, or years between the triggers and the symptom onset and the disease diagnosis. And it's very variable depending on the individual. Some people start to have symptoms of inflammatory illness, and it's like 7 years later that they get diagnosed with rheumatoid arthritis, and meanwhile they've been suffering, but they didn't have the disease fully manifest. Meanwhile, the process was flowing downhill. So what we aim to do in an integrative functional approach is start to understand what is the process that's going on in an individual patient, and what can we do about it to reverse that process. So let's talk about a little bit about this cyclic thing that's going on and why I'm talking about cycles all the time. And it has to do with the fact that all the systems of your body are one system. And one of the places we're seeing that most is what we call the gut-brain immune axis. And this is a principle, it's a relationship that is manifesting and showing up in every specialty. You look in the specialty journals of all the different ologists, whether it's rheumatology, diabetes, internal medicine, psychiatry, orthopedics, and we're starting to understand about the effects of the biome, the bacteria in the gut, the healthiness of the gut barrier, this phenomenon of intestinal hyperpermeability or leaky gut, and the way that influences the immune system. And basically, all of this affects everything else. It's a three-way street where, you could have a traumatic experience that shifts your mental emotional functioning, or you could have a lifetime of anxiety and then some gastroenteritis or something, and then the whole system goes into a new equilibrium and gets sick, where your brain's feeding into your gut, into your immune system, and the immune system's feeding back to the brain, and there's all this information going back and forth with neurotransmitters that are perpetuating anxiety. It's a whole vicious cycle, and it affects other systems like hormones and nerves, your structure, your detox and transport systems. And you are one system. The systems that we have broken it down into have been very useful for studying and developing specialty expertise, but the holistic approach of understanding all of it together is the wave of the future, and that's what we're aiming to do here. So this gut-brain immune system, bang, 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 this little triangle of relationships has been shown to be connected to all these different chronic medical conditions. Chronic pain, fibroabdominal pain, fatigue, depression, anxiety, migraine, neurodegenerative diseases, Alzheimer's, Parkinson's, neuropathy, dementia, autoimmune disease, chronic fatigue syndrome. So these are all coming out of similar underlying physiology, and my perspective and our perspective in the functional integrative approach is that it's broader than that. We tend to think about all the systems interacting with each other, and digestion, bodily structure, all of your communication, your brain, your nerves, your hormones, your cytokines, neurotransmitters, detoxification pathways, energy production, your defense and repair of your immune system. Everything's connected to everything else. Everything is related in cyclic relationships. You may have a trigger for one of them, the others start to change, and sometimes it comes back to health, and sometimes this disease process develops. And your mental, emotional, spiritual state is profoundly influencing all of this. You could say it's irrigating your entire body with the biochemistry and neurology, either of joy, connection, purpose, and meaningful living, or disconnection, fear, anger, blame, shame, and the negative emotional states are bathing every bit of your body, which is why it's so important to think about these things holistically. So these are those biological imbalances, and you could go to a different doctor for all of these things and get a different diagnosis and different medications. And a lot of people do that. And they're on a ton of medications, and they're having medication side effects. And my approach over the years has been learning to go to the core imbalances that underlie and draw together all these things because they're all similar. Notably, a lot of these things are things that people with fibro have. And what I see over and over is people with fibromyalgia asking, well, does the fibro cause the headache or the autoimmune disease? And what I'd say is probably not. No, fibro is a bunch of symptoms that happen from these underlying physiological imbalances. And those physiological imbalances can also drive these other diseases. And so the issue is getting at the core, getting at the root, not being as concerned about the disease, being more concerned about the body where it's out of balance and how to bring it towards health. My goal, my vision is to help you find health, not just diagnose your disease. So, vicious cycles moving forward, rolling downstream, the goal is to turn that around, to start to unwind the processes, to find which of the mediators we can turn off, how to avoid the triggers. We can't change the antecedents, but it can help inform how we do that work. So, the initial evaluation when I sit down with a new patient is we'll spend 90 minutes to 2 hours with a super deep dive history from the beginning of your life and even in the womb until now, and understanding what are the antecedents, triggers, and mediators. What are the likely things that are most prominent in generating your symptoms? And we do special testing. First of all, there's normal testing that happens through normal labs. You may have already had some of it done, but some of it needs to be repeated or done in a special way through the regular labs. And then there's functional labs. There's specialized labs that most doctors don't know about that are looking at some of the subtle dysfunctions in these various bodily systems that help us zero in to take that history and confirm, oh yeah, well, cellular energy is really off. We need to address that. Or, gosh, there's a huge amount of imbalance in that autonomic stress system. We need to do things to balance that. And then we do the healing work. And so how do we do the healing work? I like to think of 3 domains: mind, movement, metabolism. Mind is all your mind-body relationships, your outlook, your understanding, your level of distress, your level of your emotional state on a day-to-day basis. Your movement system is your muscles, bones, joints, nerves, and all that controls the structure and movement of your body, because it's such a profoundly therapeutic thing to move. And your metabolism is all the biochemistry of your body, all the different biochemical systems of your immune, hormone, nutrition, absorption, all of that. And so we do various things. One of the most important things on the level of mind is your mindset and your understanding and the story, the way you're relating to your experience. Do you see yourself as a victim, or do you see yourself as someone who is taking hold of your reality and making a choice how to bootstrap yourself and lift yourself out of it? And part of my job is to help you get clarity on that, to help you find the resources so that you can actually have a healing mindset and not an illness victim mindset. There's tools that you can use to help you along the road, and there's tools that help you deal with the symptoms that you have and help you transform the underlying biology. And they're the same tools, right? Things like relaxation training, mindfulness, visual imagery, where if you do it regularly, it changes your physiology, it changes your outlook. Healing trauma, healing negative emotions, learning to cope with that chronic judgmental, shamed, blamed and blaming, shamed and shaming voice inside, and transforming it so that you're actually experiencing yourself with positivity, that you're choosing to bathe yourself in the biochemistry of healing. And then whatever things you might need to do, whether it's time in nature or prayer or just quiet time alone or time in community, these are healing practices. Over time, lifestyle habits shift your biochemistry, they shift your neurology, they shift your gene expression. So if you're not willing to do the work of making change, we're probably not a good fit. If you're willing to actually say, you know what, I want to heal and I'm going to do it what it takes, then let's get to work. Come on, we got some good things we can do together. Your movement system. A lot of times people have a horrible time with PT and OT because it just makes them worse. So you got to find the right PT or OT. Some physical therapists or occupational therapists, other manual practitioners, osteopaths, chiropractors, other practitioners do hands-on techniques that can be incredibly healing for people with fibro. They turn down that neurological irritability and that brain excitability. They shift the sort of restricted reflexes and joint and soft tissue restrictions that can be pain generators and feed into that pain processing. And so the key thing is finding people in your area. Like if we're working over telemedicine, part of my role is to help you find people, help you know what to look for. How do you find a good manual therapist? When do you do manual therapy and more acupuncture versus like working on your mind-body system or working on your biochemistry? Well, like all of it's important, but what do you do first? I see a lot of people who come in and they've got fibro for years and they're going to acupuncture every week and it helps them for 4 days and it's great, but then they're miserable again. Well, they haven't even started trying to heal their own heart and mind. Or they haven't really gotten into some of the biochemical stuff that's going on that's perpetuating the problem. So it's a question of balancing these, figuring out what is most crucial, what's most relevant to you. Aerobic exercise is great if you can do it. You might need to heal a bunch to get your system tuned up so that you got the cellular energy and you got the physiologic functioning that lets you do it. So those are the things we figure out together. I don't say no to medications. Sometimes I prescribe them. I'd prefer to help you do it naturally, so it's really about healing the underlying physiology. But it's crucial that we shift your things like get you sleeping and get you out of pain enough so that you can function and do stuff to take care of yourselves. And we work that out. It's a conversation. My view is that this therapeutic plan, we do it together. We're partners. I'm here to be on your team and help you be the quarterback. I'm the guy, I'm the coach, you're the quarterback. Your body and the other practitioners you're working with, that's your team. And we're going to work together according to your values, according to what makes sense based on the history and my experience and all of the special testing we may have done to choose the things that are going to be most relevant. Quick thing here, I'm a big fan of LDN or low dose naltrexone. It can be incredibly powerful to help a person start shifting because it reduces inflammation a bit and it blocks pain and enhances mood. Some people it helps them sleep. A lot of different potential benefits, and it's very low side effect profile. But that together with all the other approaches as opposed to as its own thing. A lot of people are out there trying LDN because like, oh yeah, LDN's going to fix me. But sometimes that happens. Sometimes you actually need to do a broader aspect and a sort of balanced approach like we're talking about here. If that sounds interesting to you, please go ahead and make an appointment. I look forward to meeting you. If you want to get more information, you can check out my YouTube page, Facebook page, blog with my name, and then the Rose Wellness blog with whom I'm cooperating. There's more information about, how I work, what I do, and all that kind of stuff. So regardless, I wish you healing, and I hope you feel better, and hope to see you.